The government is today sounding an alarm over the spike in COVID-19 infections in 13 counties in the western part of the country. But of particular concern, according to the Health Chief Administrative Secretary Dr. Mwangangi, is the increase in the Delta variant, a strain considered much more deadlier. Speaking during a meeting with the Interfaith Council, Dr. Mwangangi, they were carrying out economic testing to determine the area the variant had spread with a view of containing the community transmission. While this was happening in Daraja Mbili market in Kisii County, it was just business as usual as traders sold their goods with little adherence to the laid out infection prevention measures. Now, Chemutai Goin reports that the country today recorded an 8.5% positivity rate as 218 people tested positive for the virus.
The Ministry of Health intensified surveillance in 13 counties marked as red zones that have over the past few weeks recorded a worrying increase in COVID-19 infections and deaths. The government has been forced to roll out additional restrictions, including banning congregational worship and reviewing the curfew orders.
When we look at the numbers in the 13 counties, particularly comparing them with the 47 counties in the country, one key thing that is worrying us is that the attack rate, which is a measure of the new cases within these counties, has almost gone up 15-fold.
But today, the Ministry of Health is sounding yet another alarm. Genomic sequencing conducted on the latest infections in the 13 counties, showing an increase in the Delta variant, also known as the Indian variant.
And what is of concern and of importance, and particularly to those who reside in those 13 counties, is that we have been able to pick out cases of the Delta virus. And it is important for us to ensure that we really adhere to these measures because we want to prevent community transmission.
Dr. Mwangangi spoke after a meeting with the Interfaith Council amidst protest by religious leaders from the 13 counties following the ban on congregational worship. Interior Cabinet Secretary Dr. Fred Matiang'i, who held the brief on behalf of the National Emergency Response Committee, said they were monitoring the situation and when the infections rate lowered, the restrictions would be reviewed.
We are keen on worship and we want to relook at these measures and see how best we can go forward, advised by our colleagues from the Ministry of Health, how fast we can resume worship in the 13 counties, even as we observe the measures that we are advised we must observe to keep our people alive.
We ask our religious leaders patiently to continue following these measures that have been given as we look into what we are able to accommodate. And as we all know, there is always the line of the live streaming.
Despite the call for caution, it was business as usual today at the Daraja Mbili market in Kisii County, the second largest market in Nyanza region.
Nikiwaambia wakubwa wetu waweze kutupea maji ya kunawisha mikono na sabuni ili keep distance, tupate tuko na maji ya kunawa kwa sababu tunashika pesa, tukue na sanitizer.
The traders here have seemingly thrown caution to the wind. Masks were worn inappropriately and there was no social distancing. The market's leadership seemingly giving up on controlling spaces in this crowded open-air market.
Ukiangalia ile sehemu ya watu wanaouzia nguo na viatu hawajaweza kutandika leo. Kwa hivyo ile sehemu tumeangalia ni ya kuuza nyanya na viazi na vitunguu, tuweze kuwapeleka ile sehemu nyingine ambayo imeachwa wazi ili tuweze kuwa na ile social distance ili waweze kufanya biashara.
Kenya polisi wako huku, tunajaribu kupanga na kuwaelekeza mahali ambapo wanafaa kukaa ili wasiweze kurundikana katika soko hili.
And as the government continued to enforce the laid out protocols, the Ministry of Health today temporarily halted a planned NAT delegates meeting that was set to bring together 1,878 delegates where new officials would be elected. In its letter, the ministry attributed the cancellation to the prevailing COVID-19 situation in the country, which was yet to go down, instead advising NAT to adopt a hybrid conference module to carry out its meeting. Meanwhile, the COVID-19 caseload in the country hit the 179,293 mark as 218 new cases were recorded, marking an 8.5% positivity rate. Nairobi continued to lead in county infections with 119 infections, Siaya with 26, Kisii with 20, Uasin Gishu 15 and Homa Bay 10. 15 other counties recorded between 1 and 6 cases. Chemutai Goin, Citizen TV, Nairobi.